Today we continue our COVID-19 talks with Dr. Amanda Novack from Baptist Health joining us live. Dr. Novack, thank you so much for joining us again today. Let's start by talking about the booster shots, which has been an ongoing conversation. Where are we now with the booster shots and who needs them?
So if you are confused about booster shots, that is okay because it is confusing right now. So I think it helps to sort of understand who's talking. And so when we talk about a vaccine, there's Pfizer that made the vaccine, and then there's the FDA, whose job is to make sure that drugs are safe and effective before they're commercially available in the U.S. And then separate from that, there's a part of the CDC called the Advisory Committee on Immunization Practices, so the ACIP. They're the ones that actually make recommendations about who should get the vaccine after the FDA has said that it's safe and effective. And so all of those entities are kind of coming out with their own news cycle. So Pfizer, who made the vaccine, they've done their own science that says, you know what, after about 5 or 6 months, the vaccine starts to wear off. It still protects people from hospitalizations and death. It's still really protective against serious illness. But after about 6 months, it does sort of wear off where you're more likely to get infected. And so tomorrow, the FDA is going to get together and they're going to make kind of a non-binding vote if they should approve a booster dose. So that means after maybe 5 months, maybe 6 months, maybe 8 months, that you would get another booster to help protect you. And then on the 29th of September, the ACIP will make their recommendation. And we genuinely don't know what these people are going to say. Most of the time leading up to these meetings, we sort of know which direction things are going to go. What we know now is that separate from boosters, immunocompromised people need 3 doses of the vaccine just to be fully protected. I think of vaccines as like building a fort. And so to have their fort all the way built, they need 3 doses. That's separate from normal immune systems where you just need 2 doses and your fort is strong. It's just that after 6 or 8 months, it starts to kind of get worn down and we want to bolster that. And so that's who will need a booster is after some duration of time. But it might just be that the elderly need a booster, or it might be they say everyone needs a booster. We really just don't know.
Okay, we'll be looking out for that tomorrow, the FDA meeting about that. For those who aren't vaccinated, do we know at this point what the ripple effect is and if it's having any impact on the surge of variants?
Yeah, to me, the saddest, most sort of devastating consequences for the unvaccinated, the way that it ripples out in their own personal lives, is when they pass the virus on to someone that they love. And that's really been the most tragic part to me. But at a community level, we know that when you have a lot of unvaccinated people that get infected, even if they survive the virus, each of those infections is an opportunity for the virus to mutate and change. And some of those mutations will make the virus more contagious or make people sicker. And so that's part of the ripple effect of having unvaccinated people, is that the virus has a chance to continue to grow and get stronger in the community.
And finally, we have seen a limited number of beds over the past few months with the Delta variant surging, rather. Is that still the case at Baptist Health? How are hospitals dealing with capacity right now?
Yeah, so I will say there is a palpable relief in the hospitals that cases are going down and that hospitalizations are going down. It's been better for morale. But the reality is the number of COVID patients we have in the ICU or in the hospital or on a ventilator is actually higher now than it was back in the winter at the very peak. And so while it's coming down and while that certainly feels like a breath of relief for us, there's still quite a few patients in the hospital with COVID and in ICU beds altogether. And so things are still very tight, not as bad as they were a couple of weeks ago, but it's still a little bit touch and go as far as availability.
Thank you for all you do, everyone there on the front lines. Dr. Novack, we appreciate you so much as always. And she will join us again tomorrow. We look forward to seeing Dr. Novack then, and she'll be answering your questions. Do you have a question about COVID-19 or the vaccine? You can go to our KARK Facebook page right now and submit that question, and she may answer it on the air tomorrow.